I'm presenting today on a therapeutic intervention called dry needling, used by physical therapists to treat pain. To first understand what dry needling is and what it can do, it is important to have some basic understanding of what pain is and what causes pain. Pain is a necessary, normal experience designed to protect us from causing damage, to allow us to realize when the body is being injured or in danger of being injured. However, under certain conditions, pain can go from being protective to unnecessarily overprotective. This pain can influence our relationships, our ability to take part in daily activities, and/or general well-being. Historically, we have assumed that if pain is present, then there must be some sort of damage occurring or injury present. We now know this is not the case, and pain is much more complex than that. Pain can be acute, which is pain of short duration, which occurs immediately following onset to several weeks after onset, or it can be chronic, which is pain that lasts months or even years and can last even longer after healing has occurred. In the presence of chronic pain, we can develop many changes in muscle and nerves, which can include what are known as trigger points. Trigger points can also be caused from injury or overworking a muscle and exceeding the capacity of that muscle while not allowing for normal recovery. In other words, not getting proper rest after repeated bouts of high exertion or overuse of a muscle. This brings us to dry needling. Dry needling is a safe and effective way to treat pain by treating trigger points and changing the way the body senses pain. Dry needling uses very thin needles, but does not deliver a medication. This is in contrast to wet needling, which involves hollow hypodermic needles that deliver medications used to relieve pain. I often get asked if dry needling is like acupuncture, and the answer is no. Although they use the same type of needles, they are very different techniques and have no relation to one another. Acupuncture is a technique based on traditional Chinese medicine that is intended to unblock energy meridians and help create balance of energy flows within the body, and the needles are typically left in for some time, typically between 5 and 30 minutes. Dry needling is intended to directly stimulate a trigger point or painful area in the muscle that is contributing to pain, and the needle is typically left in the body from 5 to 30 seconds. It can be left in longer, such as when using electrical stimulation through the needles, also known as pins, which is similar to the more familiar TENS units, which utilize adhesive surface electrodes stuck to the skin. So how does dry needling work? First, the skin is cleaned and prepped for needling. I insert the needle into the tissue and gently work the needle up and down without taking it out of the skin in order to find the trigger point. The goal is to get what is known as a local twitch response, which is a quick reflexive twitch of the muscle associated with the release of a tight trigger point. Oftentimes, I may provoke multiple twitch responses with one needle. This is also a release of local chemicals, including our body's own natural pain-relieving hormones, which allows for a reduction of local inflammatory processes. It should be noted that this is not effective if trying to treat someone already taking prescription opioid medications. Releasing a trigger point theoretically acts like releasing tension on a sponge being held underwater. When the sponge is released, it allows for more water into the sponge. The released trigger point now allows for more blood flow into the tissue to help reconcile what is causing the pain. Releasing the trigger point helps allow for improved range of motion within the involved tissue and in the surrounding joints. Superficial dry needling may also be performed in areas where it is not desirable to insert a needle deeper into the tissue. In this case, a small needle is inserted just below the skin surface and rotated to lead to tissue relaxation. This is commonly used around a scar to help relax the tissues around the scar and contribute to a more mobile scar. One might ask why dry needling over other interventions such as massage or other manual therapies. Dry needling allows us to directly treat underlying tissues that may be deep below the surface of the skin with little disruption to the overlying tissues. It is important, though, for the physical therapist to continue to utilize manual soft tissue and joint mobilization techniques as well as in conjunction with dry needling. It is important to note that needling is not a standalone intervention. It must be accompanied by other physical therapy interventions, including exercise, to utilize the newly gained range of motion with less pain. In the long term, it is ultimately the exercise and educational interventions that improve the condition of the patient and how they perceive their pain. Dry needling is a tool that gives us a window of opportunity to exercise and perform exercises with less pain, and that ultimately leads to improved function at home and in the community.